I'm Dr. Greer from Veterinary Village and Check Out Veterinary. And today I would like to help you better understand dog vaccinations. Judy will be helping by asking some questions, and I hope we're able to help learn some more about why vaccinations are so important to your dog's health.
So, Dr. Greer, what exactly are dog vaccinations?
Vaccinations are a killed or modified version of a virus or a bacteria given as an injection. These injections help the dog's own immune system protect themselves against those specific diseases, such as rabies or parvovirus. Without a doubt, vaccines are one of the most important medical breakthroughs in human and animal health.
Now, how do vaccinations impact the health and well-being of my dog?
By vaccinating your dog, they are able to fight infections that they would be exposed to. With vaccines that they will either get and not get sick or not get as sick from if exposed to the diseases such as Lyme disease, parvovirus, and kennel cough, these vaccines will protect them.
And are vaccinations required by law?
Only the rabies vaccination is required by law. The other vaccines are strongly recommended by your veterinary professionals, your groomers, your boarding kennels, and your doggy daycares.
Okay. And does my dog's lifestyle factor into what vaccinations my veterinarian will recommend?
Absolutely. So in our practices, we'll go over your dog's lifestyle when we customize your dog's vaccination program.
And then how soon should I get my dog vaccinated?
Yeah, and this can be really confusing. Vaccines should be started as early as 6 to 8 weeks of age for a puppy. Then they need to be repeated typically once every 3 to 4 weeks until that pet's about 18 weeks old to get full protection.
Do I really need to avoid allowing my puppy to socialize with other dogs until they are fully vaccinated?
Yeah, and this is a real difficult trade-off. Yes, you should take care when you're socializing your young puppies prior to the 18 weeks of age when they're fully vaccinated. That means staying away from standing dirty water, using flea and tick protection as early as it's safe, avoiding going to areas where there's unsanitary conditions like dog parks, and of course, going to puppy class where there are other puppies. Well, hopefully all those puppies look safe and they're undergoing vaccinations and deworming as well, so they should be safe. But socialization is too important to leave out completely. So it is a balancing act between vaccination and safety.
And then why is it important to avoid missing a dog vaccination?
Well, if you miss a vaccination, whether it's the first in the series or those as the older dogs, you're going to put your dog at risk of developing some of those pretty nasty diseases.
Okay. And what are the typical puppy and dog vaccination schedules?
So every part of the country is going to be a little bit different. Every practice is a little different. Our typical vaccination schedule is to vaccinate at 8 weeks, 12 weeks, and then the third time at 16 to 18 weeks of age, and then booster that puppy at 15 months of age, then every 3 years after that. That being said, there's variables based on what vaccines your dog has already received, what their lifestyle is, and how you want your dog to be vaccinated. We combine several vaccinations at one visit if you like, or if you prefer to split them up across several visits, that may be safer for your pet, not overwhelming the dog's immune system. So it depends a little on you, and it depends a little on the dog's lifestyle and your preferences.
Okay. And then what diseases are prevented with vaccinations?
Well, everybody knows about rabies, and that's to protect not only our pets, but to give us a buffer between wildlife and our pets bringing rabies into our life. So rabies is for human health as well as veterinary uses. So we have rabies, we have parvovirus, which a lot of people are familiar with. That can cause severe vomiting, bloody diarrhea, dehydration, and sometimes death. Distemper, we don't see as much of that in the northern states as they do in the southern states and as we did in years past, but it can still show up every now and then. That'll cause pneumonia, vomiting, diarrhea, sometimes permanent neurologic disease and death. We see a lot of leptospirosis in our part of the country. That's spread through standing water or the urine of wild animals that come up onto your lawn. That can cause liver and kidney problems and sometimes death if it's undiagnosed, untreated, or is fulminant. So it can sometimes be so acute we can't get ahead of it. Kennel cough includes parainfluenza, bordetella, and adenovirus. Those are the 3 different organisms. 2 are viruses, 1 is bacteria. That isn't as serious a disease, but it can be pretty annoying if your dog picks that up. When they've been exposed to other dogs, they come home with a cough. Influenza is similar to the kennel cough in that it causes upper respiratory disease and sometimes pneumonia. Lyme disease, we see a lot of in Wisconsin. That's spread from a tick bite from a deer or a white-footed mouse to a dog through a tick bite. We see with that arthritis, fever, lameness, and sometimes kidney failure called Lyme nephritis, and that can be fatal. Coronavirus, there's actually a coronavirus that's been around for a lot longer than ours. We rarely vaccinate for that. Then, unless they're in a breeding kennel, it's not the same coronavirus that we see. So really, if you have questions regarding your dog's vaccinations, give us a call.